My name is David Webster, and we're in the ambulance garage at St. Peter's Health, the regional medical center. The garage is where we house all of our ambulances for the 911 system. We've actually been serving Helena and the Helena Valley for just a little over 34 years. We are the transporting leg of an emergency response system that's designed to deal with medical emergencies. So we have 8 ambulances. 7 of them are in play pretty much all the time, and one of them is a reserve ambulance. If one needs to go into the shop for any duration, then we put it into service. Our staffing consists of pretty much 52 EMTs, AEMTs, and paramedics. So we have 28 paramedics, 13 advanced EMTs, and 11 EMTs. EMT is kind of our platform, our foundation, and that's a certification and a licensure you get, pretty much with 180 hours of education and some clinical time. The Helena College and a couple of the departments around the community offer an EMT course. And then above that is advanced EMT, which is more education, a few more advanced skills like advanced airway, IV, and a handful of emergency medications. And then we have paramedic, which anymore is really an associate's degree. And it, of course, is more information, more time spent with pathophysiology, disease process, and then more medications and a few more advanced skills. So as far as equipment, supplies, and gear, of course we have patient, lifting and moving equipment. So we have portable stair chair, which is a little wheeled chair, that's designed to get patients in and out of the house. We have a complement of backboards, scoop stretcher, C-spine equipment. We have, a rolling ambulance cot that goes with us, that we can put the patient on, raise and lower them, and put them into the back of the ambulance, so they don't have to, be able to sit up, if they're whatever certain injuries and illness. They need to be lying flat. They need to be not exerting themselves, so we take that cot with us. These ambulances have a load system that's designed to lift that cot, so it handles a little higher weight capacity and reduces a lot of the lifting stress off our providers, backs and hips and legs. We have a jump kit with us that has some kind of basic supplies, some assessment stuff like blood pressure cuff, glucometer. We have bandaging supplies. We have advanced airways, both endotracheal tubes and king tubes. We have stuff to decompress a chest, stuff to put in a surgical airway, so to speak. We have our monitor defibrillator, which does non-invasive blood pressure, 12 lead EKGs, Untitled CO2 monitoring, pulse oximetry, numerous oxygen delivery devices, portable oxygen tanks, suction. We have a portable chest compressor for cardiac arrest. We have the Lucas device that provides chest compressions, multiple IV solutions and setups, a whole bunch of different bandages from burn sheets to 4x4s to quick clot gauze. We have a precipitous delivery kit, like if there's a child that's born in the field, we carry a kit to address that. We have specific pediatric equipment to address, any range of kids. I think the EMS profession as a whole is kind of misunderstood and overlooked. and nobody really understands what happens when you call 911 and those folks walk through the door. And then, we're more than just a conveyance to the hospital. We really have a lot of assessment and treatment options that we bring with us, essentially bedside. And so we're really, kind of a mobile emergency room. And we have a lot of stuff we can do until we can get you to more definitive care in the actual hospital. So I guess we're a lot more than drivers. We have a lot of very specialty training, specialty equipment, and skills that we bring with us.